Those of us who have learned to look at health through the lens of functional medicine know that every body is different. We are very complex creatures, and each of us has different genetics, lifetime exposures, dietary needs, and lifestyles. And each of these differences play a role in how our bodies handle things like stress and toxins and infections and foods. The Institute for Functional Medicine has divided all of the human body functions into systems. I'm going to take a short time to review the IFM model because it gives you a way to look at your body and your life to see all of the different things that can and have played a role in how your body functions right here and right now. For the purposes of this program, after I introduce the Institute of Functional Medicine's way of looking at health and root causes, I'm going to show you how I've further simplified these concepts to best fit our needs over this short period of time that we have together. But for this moment, let's briefly talk about the IFM model. The Institute for Functional Medicine looks at body systems. What does this mean? Well, most of us learned human biology in high school and know about organs and organ systems like the brain, the liver, skin, stomach, etc. Western medicine has come up with specialists for each of these organs. A dermatologist for your skin, a cardiologist for your heart, a neurologist for your brain. You get the picture. Everything affects everything else. So, the health of your gut affects what happens in your brain and the strength of your immune system and even why your knee might hurt. Your heart is affected by your gut, also by your nutrition and your hormones and your nervous system and more. So, if we try to connect the dots between organ systems, there would be just a ton of lines connecting everything to everything else. And what a mess that would be. So from a functional medicine root cause way of looking at things, there are 7 major systems or processes that generalize specific functions of the body. So here they are. And you don't really need to remember them for the purposes of this course, but I just wanted to mention them to you. They are assimilation, transport, biotransformation and detoxification, communication, defense and repair, energy, and structural integrity. These are really big things, and every one of them is consistently happening at every minute of every day in our bodies. And they're very complicated, even complicated to define. So because these are pretty advanced concepts, I'm not going to be using this exact breakdown when I talk about the different systems in your body, but I thought it would be helpful to understand how functional medicine looks at things based on the concept that everything, every system, impacts everything else. And this is why looking at things from a functional medicine perspective is different than going to, say, a neurologist for a degenerative neurologic condition or to a cardiologist for a heart condition or a dermatologist for a skin condition. They may be the best to give you a diagnosis and may be the best to offer you ideas to optimize your current function with the health issues that you have. But here's the difference. Functional medicine looks to find the root causes of these issues so that from a deep level in your body, systems can be improved and healed so that the underlying causes resolve, which then can have a big impact on the progression of whatever health issues happen to be the problem. The hope is that the health issues that you have will be slowed, stopped, or reversed by improving those deeper root causes rather than just modifying them through the use of medications or surgery. The take home from all of this for you is that as we move forward through this course, remember that most chronic illness and symptoms have root causes, that everything is connected to everything else, and that each little improvement you make has the potential to change things for you in huge ways. Now, let's look at how functional medicine evaluates all of the things that can be at the root of why a body has the problems that it does. We call them antecedents, triggers, and mediators. Let's start with antecedent. An antecedent is something that is either a part of your genetic makeup or something that was acquired early on that impacts how your body deals with an illness or a pattern. For example, if your body has genetic variations that make it more difficult for you to break down certain toxins, if you don't know that or you haven't figured it out, your body could get into big trouble because of the growing burden of these particular toxins. Things like cancer or autoimmune disease. Or if you were born by C-section rather than through a birth canal, chances are that you didn't get that initial supply of important good bacteria for your gut that ultimately helps with better digestion and improved immunity and so much more. So that's another example of an antecedent. We all have them. So now let's talk about triggers. A trigger is something that your body goes through that can provoke signs or symptoms of illness. So an example of this would be a car accident or a major emotionally stressful event, or maybe a surgery or a big infection. These triggers can be game changers to many systems of your body all at once. I've heard so many people, when they tell me their story, they may say, "Dr. Laura, I was fine until I had my third child, and then everything changed." Or, "I was fine until that car accident." Or, "I was fine until the death of my husband, and then everything changed." A very recent example of a trigger would be the people who have had chronic symptoms after a COVID-19 infection. The people we're calling the COVID long haulers. These people are suffering long-term symptoms similar to some autoimmune disorders. The example here is that the COVID-19 infection would have been the trigger. An antecedent, perhaps, could be that they had a genetic variation that caused their immune system to react this way. Okay, so now the third thing we look at when we look for root causes are called mediators. A mediator is something that's going on that adds to the story. It can be biochemical, psychosocial, or many other things. A mediator in the case of long haul post-COVID syndrome would be maybe that the patient had underlying blood sugar elevation or had another autoimmune condition that affected the way their immune system actually responded to the virus. So do you kind of get it now? Antecedents, triggers, and mediators. Using the functional medicine model, we take a very detailed history, and then we create a timeline. Very often, if we take the time to do this, many patterns as to how things happened and got this far afield, they start to come clear. Finding these patterns can be very helpful in helping the body to unwind, in a sense, and turn the course toward healing. In the written materials, you'll find root causes worksheets. It would be very helpful if you were able to take 30 minutes or so and fill in the timeline and name your antecedents and your triggers and your mediators. By putting it all in an organized format, you can look at yourself from a root cause perspective. It's often very enlightening to organize and understand things in the timeline of your life. It really helps to make sense of things and to highlight for you when and how certain health issues in your life may have started, or what's making them worse, so that you can concentrate on successfully unwinding some things to start getting your health under better control. So I strongly recommend this. Did you have antecedents like birth trauma, bottle feeding, early antibiotic use, things like that? Then take a look at your triggers. We all have so many triggers: athletic injuries, car accidents, pregnancies, emotional traumas, major infections, surgeries, hospitalizations, travel, so many. And then we add the mediators. Are you currently on medications? Do you have a chronic illness like diabetes or autoimmune disease or heart disease? Do you have a poor diet? Do you not eat enough veggies? Do you have a long-term difficult living situation? There are so many things that can act as mediators. And then you make sure you add in the things that have happened in your health. Where are they on the timeline? When did you start feeling so tired? When did your hair start thinning? When did the pain start? When did the sleep issues start? Very often, creating a timeline with antecedents, triggers, and mediators can be incredibly helpful in untangling your body's story. I strongly recommend that you sit down at some time in the next couple of weeks and complete the root causes worksheets about your health and your life history. Let's see what you can learn.